Welcome to the Neuro Clinic. We're your hosts. I'm Dr. Casey Oliver.
And I'm Dr. John Hatch.
Thanks for joining us. We're down here in Lehi, Utah. We wanted to just introduce ourselves more than anything and kind of tell you a little bit about, of our story, how we met, why we're here, and what we do here in the clinic. In our scope of practice as chiropractors, as doctors of chiropractic, we're not allowed to prescribe medications, and we don't do surgeries here in our clinic. So if that is necessary for the patient, we're more than happy to refer out to the medical physicians that perform those types of procedures. What we do is we use the sensory systems to make changes to the brain or the parts of the nervous system that need attention.
The reason why I got into this field of chiropractic neurology was, as going through school, there was a patient or a friend of mine that was very close to me that had Parkinson's and had a resting tremor. And what can you do chiropractically for that? It was extremely hard to really understand what to do. And so I started training under Dr. Frederick Carrick, and he taught us how to understand Parkinson's disease specifically and the problem in the nigra and an area in your brain, and then treat it or do therapies that would make a change. And my first patient I had ever saw had a tremor, a resting tremor for 2 years, and it altered in about 15 to 20 seconds of therapy, and it had changed my whole life and view of what I wanted to do and become.
I started chiropractic school with a really open mind. I really didn't have any sense of a specific technique or what I wanted to do. When I first started chiropractic school at Life West Chiropractic, my skeletal anatomy teacher was Dr. Stephen Wellens, who's based out of Northern California in the Bay Area. And he was a board-certified diplomate in the chiropractic neurology field. And I just remember we would cover what we needed to cover during the classes for however long that needed to take to get the information so that we could pass our board examinations and stuff like that. And then he would spend the rest of the time posting case studies and these really cool videos that he would show us of the patients that he was working with. And it's very similar to what Dr. Hatch had experienced. The thing that just caught my attention was a case that he posted that was also a movement disorder, but it was of the legs, the lower extremity tremor of a woman patient that he had been working with. And I just thought it was the coolest thing I've ever seen, his ability to help calm that tremor using very unique therapies. And so from that moment forward, I had just committed that to work and to study as much as I needed to about neurology so that I could implement that in my practice as well. And so, I mean, it was my fourth quarter in chiropractic school. I had started taking some of the courses through the Carrick Institute for Graduate Studies, and it was best decision I made. Aside from choosing to come and work here with Dr. Hatch, best decision I made clinically by far. How did this is how Dr. Hatch and I met. I was involved in the exercise science program at Brigham Young University. That's where I went to and got my Bachelor of Science degree in undergraduate school. And personally, I can't remember the very first time that we met because we had a couple classes together, and the class sizes, I mean, they're fairly large, so you don't get to know everybody in there. I remember one thing specifically about Dr. Hatch. It was in our sports nutrition class. He was the one that actually volunteered to, the teacher was trying to explain to us how the esophagus worked and how you could swallow things and the whole principle behind peristalsis and getting food down into your stomach. And so how he wanted to illustrate that by having someone do a headstand and drink apple juice or something, or apple or water. And so Dr. Hatch volunteered, and I just thought that was the coolest thing. But I don't remember the exact moment that we got together, but we had some classes together.
And now looking back, we've actually figured out we had 6 classes in undergrad together and didn't really connect until, for us specifically, an orthopedic and impairment class presented by Dr. Phelan, who's a leading physical therapist at the Brigham Young University. He gave a class on that, and that's where we really joined together and did a presentation on a certain ailment. And after that, we became really close friends. And
we suffered through organic chemistry. Yes. We were study buddies for that class, I remember.
And we were study buddies for multiple classes after that. And then we went to chiropractic school at different times. And at the end of chiropractic school, right as he was graduating, I was a year behind. And I said, we have to join together. We have to have a practice together.
Yeah.
And that's where it's all began.
It was kind of a process, because after I graduated, I had joined up to work as an associate doctor at Neuralink Chiropractic in the Bay Area. And I worked there for, what was that, like a year and a half?
Mm-hmm.
Yeah. And the experience was good. I learned a lot, but I knew that this was something that we needed to do. And I knew that we needed to partner up. And so when Dr. Hatch graduated from school, he came right out to Heber City in Utah. And it was only a matter of time until we made that decision to jump and work together.
Yeah.
It's been amazing. So this is how the Neuro Clinic came to be. And I'll let Dr. Hatch start with this one, because the Neuro Clinic, first and foremost, is the name that Dr. Hatch gave this clinic. And I mean, that's always been the focus of our clinical practice here, in helping people with some pretty serious neurological disorders. But how did you do it?
So when I first graduated, in the last year of chiropractic school, we really focused on the business aspect, how to get the name out, what's your name going to be. And I did a minor in business administration, and wanted to know, okay, what grabs people, what attracts people, and what sets me apart differently, or our clinic differently than anything else. And so when I first graduated, we knew we wanted to be a chiropractic neurology-based clinic, not just a chiropractic office, but focusing in functional neurology. And so I wanted something that based that name in it. And so we came up with the Neuro Clinic, came up with the symbol, designed it. It has a triangle in it that represents the balance that we're trying to perform within the brain, within your gut function. And those types of things are done as a representation for the Neuro Clinic. And so I worked up in Heber for a year with a great doctor there, Dr. Jared Nielsen, and then he gave me the dream and the vision to move and go pursue my dream. And that was to really base a clinic in the neurology program the best we can. And we joined up together and moved down here to Lehi to be central here in Utah. We always wanted to be here. This is where we wanted to be. You've probably heard a lot about functional neurology in the news lately, with the traumatic brain injuries or the concussions with some of the sports athletes, some of the top athletes in the world returning to play after these head traumas. And what most of you have heard about is functional neurology, but we don't know exactly what it does. And so today we wanted to explain a little bit about more what we do as functional neurologists. And that comes down to understanding the brain.
One of my favorite seminars I attended through the Carrick Institute was actually taught by Dr. Thomas Colleton. And at the beginning of the seminar, he introduced us basically to this concept of neuroplasticity. And he actually told us to run out and grab a book that was actually written by Dr. Norman Doidge. It's called The Brain That Changes Itself. And this is a very, very informative, descriptive book that talks about the principles of neuroplasticity. And we just want to explain, with the time that we have with you, a little bit about what that is and what it means. For a long time in neurology, it was thought that the brain was hardwired. It was wired in one specific way, and if you lost function or portions of brain to injury or whatever it may be, that it was gone, and you couldn't get that function back. Now we know through principles of neuroplasticity that that's just not true. We know that you can rewire the brain. Neurogenesis, or in other words, regeneration of nerve tissue, is a possibility. And so that's what we want to get into today.
Mm-hmm. And so our job as functional neurologists is to determine the exact area that isn't functioning, whether that is in your brain stem, whether that's your balance coordinator called the cerebellum, is it up here in the cortex, or is it down here like in the tissue or the input into it? And we got to find out which area isn't working, and then how can we adapt different therapies to change that output and get that to restore to a better functioning system.
So with the concepts there of what functional neurology is, and like Dr. Hatch had described, our biggest job, or our hardest job as practitioners, is to isolate what we refer to as the longitudinal level of the lesion, which is what Dr. Hatch just explained there. What part of the body is being affected most? And so because in our scope of practice as chiropractors, as doctors of chiropractic, we're not allowed to prescribe medications, and we don't do surgeries here in our clinic. So if that is necessary for the patient, we're more than happy to refer out to the medical physicians that perform those types of procedures. What we do is we use the sensory systems to make changes to the brain or the parts of the nervous system that need attention. So we understand as human beings that we're receptor-driven people, and what I mean by that is we're surrounded by gravity. That's one constant stimulus that basically keeps the nervous system alive. So the therapies that we apply, which we'll get in very in-depth as we go throughout the series, is we'll talk about what that means to be receptor-driven people and the therapies that we apply and how that works for you, using sight, sound, taste, touch, smell, you name it. All right, everybody, thanks for watching. Thanks for giving us some time to let us kind of give you our story and how it is that we started the NeuroClinic here. Join us next time. We're going to be giving you essentially a tour of the office and showing you what it is that we do here in the clinic.
Thank you again, and if you would like to read up any information or know more about us or contact us, the easiest way is to go to theneuroclinic.org. And on the website, it has all of our office numbers, emails, etc. Again, that's theneuroclinic.org.
Thanks for watching us here at the NeuroClinic. I'm Dr. Casey Oliver.
And I'm Dr. John Hatch, and we will see you next time.